Natural and home remedies for myocardial infarction. A heart attack, myocardial infarction, is usually caused by a blood clot, which stops the blood flowing to a part of your heart. Muscle. You should call for an ambulance immediately if you develop severe chest pain. Treatment with a clot-busting medicine or an emergency procedure to restore the blood flow through the blocked blood vessel are usually done as soon as possible. This is to prevent or minimize any damage to your heart muscle. Other treatments help to ease the pain and to prevent complications. Reducing various risk factors can help to prevent a heart attack. If you have a heart attack, a coronary artery or one of its smaller branches is suddenly blocked. The part of the heart muscle supplied by this artery loses its blood and oxygen supply if the vessel is blocked. This part of the heart muscle is at risk of dying unless the blockage is quickly removed. When a part of the heart muscle is damaged, it is said to be infarcted. The term myocardial infarction, MI, means damaged heart muscle. If a main coronary artery is blocked, a large part of the heart muscle is affected. If a smaller branch artery is blocked, a smaller amount of heart muscle is affected. After a heart attack, if part of the heart muscle has died, it is replaced by scar tissue over the following few weeks. Blood clot, thrombosis, the cause in most cases. The most common cause of a heart attack is a blood clot that forms inside a coronary artery, or one of its branches. This blocks the blood flow to a part of the heart. Blood clots do not usually form in normal arteries. However, a clot may form if there is some atheroma within the lining of the artery. Atheroma is like fatty patches or plaques that develop within the inside lining of arteries. This is similar to water pipes that get furred up. Plaques of atheroma may gradually form over a number of years in one or more places in the coronary arteries. Each plaque has an outer firm shell with a soft inner fatty core. What happens is that a crack develops in the outer shell of the atheroma plaque. This is called plaque rupture. This exposes the softer inner core of the plaque to blood. This can trigger the clotting mechanism in the blood to form a blood clot. Therefore, a buildup of atheroma is the root problem that leads to most cases of ACS. The diagram below shows 4 patches of atheroma as an example. However, atheroma may develop in any section of the coronary arteries. Heart attacks are common. About 146,000 people in the UK have a heart attack every year. Most occur in people aged over 50 and it becomes more common with increasing age. Sometimes younger people are affected. A heart attack is 3 times more common in young men than in young women. However, after the menopause, the female hormones no longer protect the heart, so the risk is then the same for men and women. A heart attack may occur in people known to have heart disease, such as people with chest pain called angina. It can also happen out of the blue in people with no previous symptoms of heart disease. This is because fatty patches or plaques, called atheroma, often develop without any symptoms at first. Certain risk factors increase the risk of more atheroma forming. This can lead to ACS. See separate leaflet called Preventing Cardiovascular Diseases for more details. Briefly, risk factors that can be modified and may help to prevent a heart attack include smoking. If you smoke, you should make every effort to stop. High blood pressure. If your blood pressure is high, it can be treated. Being overweight. Losing some weight is advised. Losing weight will reduce the amount of workload on your heart and also help to lower your blood pressure. Cholesterol. This should usually be treated if it is high. Inactivity. You should aim to do some moderate physical activity on most days of the week for at least 30 minutes, for example, brisk walking, swimming, cycling, dancing, gardening, etc. Diet. You should aim to eat a healthy diet. Diabetes. People with diabetes have a higher risk of having ACS. This risk can be reduced by ensuring your blood pressure, cholesterol levels and blood sugar, glucose, Levels are well controlled. Family history. Your risk is increased if there is a family history of heart disease or a stroke that occurred in your father or brother aged below 55, or in your mother or sister aged below 65. Ethnic group. Certain ethnic groups, for example, British Asians, have a higher risk of developing cardiovascular diseases. The most common symptom is severe chest pain, which often feels like a heavy pressure feeling on your chest. The pain may also travel up into your jaw and down your left arm or down both arms. You may also sweat, feel sick and feel faint. You may also feel short of breath. The pain may be similar to angina, but it is usually more severe and lasts longer. Angina usually goes off after a few minutes. Heart attack pain usually lasts more than 15 minutes, sometimes several hours. However, some people have only a mild discomfort in their chest. The pain can sometimes feel like indigestion or heartburn. Occasionally, a heart attack happens without causing any pain. This is usually diagnosed when you have a heart racing, electrocardiograph, or ECG, at a later stage. Some people collapse and die suddenly, if they have a large portion of heart muscle damaged. This is not very common. Then, if you have some, take one aspirin tablet, see below for the reason for this. You will normally be admitted straight to hospital. Many people develop chest pains that are not due to a heart. For example, you can have quite bad chest pains with heartburn, gallbladder problems, or with pains from conditions of the muscles in the chest wall. Therefore, tests are usually done to confirm a heart attack. These are a heart racing, electrocardiograph, or ECG. There are typical changes to the normal pattern of the ECG in a heart attack. Patterns that occur include things called pathological Q waves and ST elevation. However, it is possible to have a normal ECG even if you have had a heart attack. Blood tests. A blood test that measures a chemical called troponin is the usual test that confirms a heart attack. This chemical is present in heart muscle cells. Damage to heart muscle cells releases troponin into the bloodstream. In a heart attack, the blood level of troponin increases within 3–12 hours from the onset of chest pain, peaks at 24–48 hours and returns to a normal level over 5–14 days. A rough idea as to the severity of the heart attack, the amount of heart muscle that is damaged, can be gauged by the degree of abnormality of the ECG, and the level of troponin in the blood. Another chemical that may be measured in a blood test is called creatine kinase. This too is released from heart muscle cells during a heart attack. Your ECG will be monitored for a few days to check on the heart rhythm. Various blood tests will be done to check on your general well-being. Other tests may be done in some cases. This may be to clarify the diagnosis, if the diagnosis is not certain, or to diagnose complications such as heart failure if this is suspected. For example, an ultrasound scan of the heart, echocardiogram, or a test called a myocardial perfusion scan may be done. Also, before discharge from hospital, you may be advised to have tests to assess the severity of the fatty patches or plaques. Atheroma, in the coronary arteries, for example. An ECG taken whilst you exercise on a treadmill or a bike, exercise tolerance test. An angiography of the coronary arteries may also be performed. In this test, a dye is injected into the coronary arteries. The dye can be seen by special X-ray equipment. This shows up the structure of the arteries, like a road map, and can show the location and severity of any atheroma. This often depends on the amount of heart muscle that is damaged. In many cases, only a small part of the heart muscle is damaged and then heals as a small patch of scar tissue. The heart can usually function normally with a small patch of scar tissue. A larger heart attack is more likely to be life-threatening or cause complications. Even before treatments became available to restore blood flow, Many people made a full recovery. With the help of modern treatment, particularly if you are given treatment within a few hours to restore blood flow, a higher percentage of people now make a full recovery. Some possible complications include the following: heart failure. If a large area of the heart muscle is damaged, then the pumping ability of the heart may be reduced. Less blood than usual is then pumped around the body, especially when extra blood is needed when you exercise. Symptoms such as breathlessness, tiredness, and swollen ankles may develop. Mild heart failure can often be treated with medication. Severe heart failure can be serious and even life-threatening. See separate leaflet called Heart Failure for more details. Abnormal heart rhythms may occur if the electrical activity of the heart is affected. The main risk of this happening is within the first few hours after a heart attack. Sudden, chaotic, fast heartbeats may occur. This is called ventricular fibrillation and is the common cause of cardiac arrest. This needs immediate treatment with an electrical shock given by a defibrillator. Otherwise, collapse and sudden death are likely. Other less serious abnormal heart rhythms can also occur, which can often be treated with medicines. See separate leaflet called Abnormal Heart Rhythms, Arrhythmias, for more details. A further heart attack may occur sometime in the future. This is more likely if the coronary arteries are badly affected with atheroma, or further buildup of atheroma continues. If the risk of this is thought to be high, then surgery may be advised to bypass or widen severely narrowed coronary arteries. The most crucial time is during the first day or so. If no complications arise and you are well after a couple of weeks, then you have a good chance of making a full recovery. A main objective then is to get back into normal life and to minimize the risk of a further heart attack. Fish oil. Fish oil contains healthy fats in the omega-3 fatty acid category. Incomplete evidence suggests that fish oil supplements may help prevent heart attacks, as well as prevent sudden death after a heart attack. 17.23,29 This benefit may be due any one of a number of fish oil's actions, including preventing dangerous heart arrhythmias and reducing heart rate. 7,1820 Garlic. In one study, 432 people who had suffered a heart attack were given either garlic oil extract or no treatment over a period of 3 years. The results showed a significant reduction of second heart attacks and about a 50% reduction in death rate among those taking garlic. Arnica treats shock, mental and physical, and is the first remedy to give at the time of a heart attack. Patient experiences a feeling of a shock in the heart with sudden squeezing pain extending to left elbow specifically. Extreme horror of death. It will calm the individual, stem any internal bleeding, lessen bruising internally, and provide overall tonic effect.